Hello everyone, Assalamu alaikum. Thank you so much for having me. I'm delighted to be here. What a beautiful day it is. I'm so happy to share it with all of you. Thank you for joining me here with this morning. I'm Fatima Saad, the Assistant Professor of Public Health Department in the Malay University of Science and Technology. I'm here to be present my abstract. I'm sharing my screen to present my abstract here. Okay. Today my abstract topic is the role of immunological and metabolic factor in the prognosis of diabetes type 1. You know what is diabetes? The diabetes type 1 is a disease that seriously affects the lifestyle of the pupil. It can conversely stated that the lifestyle of pupil causes this disease. Diabetes mellitus is a multi-system disorder involving all metabolic pathway resulting in the hyperglycemia and glycosuria. Diabetes causes immense changes in daily routine of patients that leads to mental stress, deprivation, and depression. Here's the prevalence of the diabetes. The actually diabetes is occurring in increased rate of 3% to 4% around the world. This is very significant threats of public health. The scientist Menges it's saying about 2013. It has been predicted that by the year of 2035, there will be around 592 millions of diabetics. The 80% of diabetes live in low and middle income countries, and of the total, more than 60% live in Asia, with almost one third in China. Type 1 diabetes is mostly observed in young age group, which poses challenges, management strategies that attempt to early regulate of blood glucose level minimize the chance of early development of complications. It is suggested that the immune responses they elicited by genetic and environmental factors, the facilities of development of type 1 diabetes. Do you know what is the role of the production of the interleukin 2? Could interleukin 2 be important in the prognosis of diabetes type 1? Yes, the rationale of my study is that the importance of diabetes is association of interleukin 2 with antibodies and development of diabetes. The present research may prove to be a stepping stone in the unraveling of the underlying alteration in the biochemical process lead to diabetes. Immune system is comprised of several highly effective molecules that play a major role in the development of the disease. The examination of these molecules and the intensity of their correlation may prove to be an unknotting link leading to discovery of novel tools for prevention. The early diagnosis and convenient management is reducing the economic burden on society too. Our study methodology, the convenient sample of 100, the 50 is the cases and the 50 is the control. The cases are the diabetic patients and the control are the first degree relatives. Both the cases and the control, they should be written and concerned verbal form to inclusion in the study. After the patient of 12 hour or fasting, the verbal written consent was taken. They are the physical examination, the BMI and the WHR, and after that the venous blood sample collected and run by the ELISA technique. Both type 1 diabetic patients and the first degree relative, they both are analyzed by chemical parameter and the physical parameter. The chemical parameter we would be run the interleukin 2 level and the C peptide level, and the physical parameter they are the BMI and WHR. Our result can be shows that some key points of the result. This is the may the pretended the possible of development of diabetes in the relatives. We see peptide level, the insulin synthesis also does not differ between two groups. The significantly higher BMI of diabetic patients may be a factor of resistant C peptide level. Concordant the previous finding that a higher BMI facilitates beta cell proliferation and thus the insulin synthesis. Though the BMI has been for ages used an indicator of the obesity. The hip-waist-hip ratio indicates for fat distributions, and the WHR is thus a health predictor with respect to obesity-related disorders. Abdominal fat is an immense health hazard, thus a higher WHR is an obesity-related is the disease marker. This graph shows the correlation of WHR with interleukin 2 in first degree relatives. They show a positive correlation between WHR and interleukin 2 in the first degree relatives of diabetes. Abdominal fat is an immense health hazard with a higher WHR is an obesity related and to pretend the probability of developing diabetes. This correlation of C-peptide with fasting blood glucose sugar in diabetic patient is the negative correlation between FBS and C-peptide in diabetic patient. The fasting blood glucose is negatively correlated with the C-peptide level in diabetic patient, endorsing the depletion of pancreatic activity and resulting in diabetes. Our result shows that the interleukin of interleukin family is implicated the regulation as well as the dysregulation of Treg functions. It is the activity of any of these molecules, these cytokines independently or of more than one cytokine synergistically that leads to release of autoantibody and destruction of the pancreas. Precisely, the induction of Th1 cell influenced by the interleukin 2 leads to activation of cell-destructive molecules, secretion of autoantibodies, and beta cell destruction. Our last slide shows that the interleukin 2 being secreted from CD25 cell, and this interleukin 2 along with the IFN interleukin 4 induce cells leading to the activation of macrophages, CD8 cells, IgG cells, and consequently autoantibodies that damage the pancreas. They are indirectly connected to glucose, C-peptide, autoantibody, BMI, and WHR. The C-peptide, they are connected to destruction of the pancreas, decrease release of C-peptide and insulin in the presence of hypertonic stress, the induce of interleukin 2. The autoantibody, the interleukin 2 enhance the Th1 cells that reduce macrophages, phagocytosis, and autoantibodies. And the BMI, the gradual increase of body mass index across the lifespan, individual lends to develop impaired glucose metabolism, and the WHR and glucose, they are directly connected. The high level of interleukin 2 in diabetic patients as well as their first degree relatives lead to the identification of a common factor in the pathogenesis of diabetes. The absence of difference in the C-peptide level may be related to the beta cell inefficiencies of both groups. The negative correlation of C-peptide with fasting sugar blood glucose in diabetic patients is potentially support in decline the endogenous insulin synthesis. Today, my topic is enhance the diabetic patient in further interleukin 2 levels and autoantibodies to check the correlation between diabetic patient in related to first degree relative. Hope you all understand my abstract and my topic and enjoying this. Thank you so much.